Okay, so I'm demonstrating rebound tenderness. So what I'm going to be doing is in the left lower quadrant. So basically, the main organ we have there is the sigmoid colon. The rebound tenderness checks for peritonitis. So I want to palpate the left lower quadrant, for about 15 to 30 seconds. So I'm going to palpate here, and what I'm looking for is any increased pain on the withdrawal from the quick palpation. I spend about 15 seconds. So after I let go is when the patient should experience symptoms. So what happens is basically you're pushing the peritoneum of the intestines, and because it's inflamed, it basically rebounds back after the pressure of palpation has been released. Any pain with that?
No.
Okay, so a little bit more information about the rebound tenderness. You always want to start away from where the pain is, as well as test every single quadrant for that rebound tenderness, which is the inflamed peritoneum rebounding back, causing pain for the patient. Okay, so now I'm going to percuss the abdomen. I should be seeing a lot of tympanic noises, which is like a dull, hollow drum sound. Mostly in the intestines, as well as the stomach, because it's going to have a little bit of a gastric bubble. If I find any dullness in the intestines or in the left lower quadrant, or perhaps the right lower quadrant, it could be indicative of any mass or bolus of either feces or any gas or anything. So I'm going to begin with the left upper quadrant. So in here we have the stomach and part of the pancreas and kind of part of that transverse colon. So I'm going to place my fingers here, and I'm just basically going to percuss. So now I have that tympanic sound. Kind of move around the quadrant. Nice tympanic sound there. Also, when you're doing this and you may find some dullness, it could also be indicative of any enlarged organs. So it's a little dull there, so my patient might have some food going through his intestines right now. That was the left lower quadrant. So now I'm at the right upper quadrant. So this is where more upper at the base of the lung, you're going to get more of a resonant sound, which is kind of like a whistling kind of sound, kind of hollow with the lungs, but not tympanic. And the liver is also here, and the liver is going to be dull because it's a solid mass. There's that dull sound. And then I can also measure, if I wanted to, from the mid-clavicular line coming down. I can measure the size of the liver on this side, and also I can do it from the mediastinal area as well. So now I'm going to go to the right lower quadrant. So here we have the cecum. We have the appendix and part of the ureter for the right ureter, as well as, some of the portions of the kidney. So a little bit about the abdominal percussion testing. You want to do it at least 2 to 3 times in each area before you move on. And just like the rebound tenderness, you want to kind of, if they're experiencing any pain in any quadrant, you kind of want to go to the other quadrants first. So you basically use your non-dominant hand to be the one that you're compressing. So you can use, usually the middle finger is good, or you can use what we learned in class, the 2 fingers here. So this is a video to answer the questions that were asked. So what is the sound you expect to hear over a normal liver? That's going to be a dull sound because it is a thick tissue, and it has many components to it, and it's also very large. Just like other organs, you're going to get other solid organs such as the spleen or possibly the kidney. You're going to get a more dull sound rather than a hollow or drum-like sound, or definitely not a resonant sound. That would be more so of the lungs. Rebound tenderness of the lower left quadrant. What is this testing for? That's testing for peritonitis. Basically, what happens with the rebound tenderness test is that once you press in, you're going to be kind of aggravating that inflamed peritoneal tissue, and with when you release, that's when that tissue kind of rebounds and kind of elicits some of that same pain that the patient's been feeling.